Okay, so let's start this session. My name is Musfira Kamar and I'm from second year MBBS. I am an associate at Guidance Department of IMIG. Guidance Department is responsible for hands-on workshops and has conducted a number of successful workshops, including suturing, IV cannulation, and examination. We have also conducted a number of successful online sessions, including match panel and elective guidance session. Today, we are here with FCPS guidance session. For those of you who are planning to give FCPS and have any question or confusion regarding it, this session will help you. So stay with us till the end. And if you have any question, please ask in the chat box. Dr. Farooq Javed will be our speaker for today's session. He has cleared both part 1 and part 2 of FCPS and is currently working as assistant professor at JPMC and consultant neurosurgeon in Karachi. Dr. Farooq, you may begin.
Okay, thank you so much. First of all, I would like to thank to you guys and your whole, group or the department you guys are dealing with, and it is very fortunate to have you guys. And I hope I will be able to clear your questions and queries. My name is Dr. Farooq Javed, and I'm working as an assistant professor and consultant neurosurgeon in the Department of Neurosurgery at JPMC. And I cleared my FCPS part 1 long time ago, but throughout these years, I have been in contact with all the uh, medical students, house officers, and then obviously for the candidates who are appearing in different kind of FCPS exam. So I am well aware of the challenges and also the troubles and the problems they face during their whole journey of FCPS exam. So I would like to just give an overview of the FCPS exam and FCPS pathway, and then I would like to discuss about different preparation method, books, and all uh, the pathway from FCPS Part 1 to the FCPS Part 2 or the exit exam. And I would like to answer your question at the end of that presentation or mini session. Okay. So, talking about FCPS, first, obviously, we need to know why do we need the FCPS exam or degree to work anywhere in the world, or particularly if we are talking about Pakistan. Is it the only option in Pakistan, or do we have other options as well? Similarly, we will talk about the benefits of doing FCPS and what are different problems or difficulty levels that we face throughout the journey of the FCPS. Similarly, we will talk about the local scope and also the international scope of FCPS qualification. So, talking about first, I will talk about the scope of the FCPS in Pakistan and abroad as well. In Pakistan, obviously, it is one of the gold standard postgraduate qualification. It is not only it is not the only degree or qualification related to postgraduate, but it is one of the gold standards and the highest one that we can have here. Apart from the FCPS, we do have different kind of qualifications, like we have different diplomas. We have MCPS degree from CPSP. Then we have MS and MD program for different universities. But talking about the FCPS, generally, we talk about the FCPS that this is the highest kind of degree we can have in Pakistan. It can be a primary FCPS degree or a secondary FCPS degree as well. Like if we talk about the primary one, that if we first time we do an FCPS qualification in any particular field, and then we have the super fields as well, or super specialties we call them. So we can go for a second FCPS or second fellowship in a particular field of medicine or a surgical department. So uh, we can achieve that super qualification as well, but that will again be the FCPS degree. And it is generally required for different kind of appointments and jobs in Pakistan, particularly if we are going for a tertiary care hospital where they're required to have a particular faculty in their department. So they usually hire qualified uh, uh, consultants for the post. they generally do not opt for lower kind of degrees, as I already talked about diplomas and MCPS and those things. But when we talk about the faculty level postings like senior registrar, uh, assistant professor, associate professor, and professors, or head of departments, they usually go for an FCPS qualification, and they require these kind of degrees to hire you. Similarly, in private setups, they do. I mean, with the with a large number of people passing out with FCPS degree, they do have a large pool of FCPS qualifiers. So they usually go for, they have the, I mean, they have the option of opting from a large pool of FCPS rather going for a lower kind of degree. But it doesn't mean that it's the only pathway. You can go for MS or MD pathway. They can be equal to the FCPS, and they are also, I mean, those degrees can also be used for a faculty level posting if we are talking about MS or MD programs. But still, we see that FCPS people are more in number, and they are taken as kind of a well structured program or a higher qualification as compared to MS or MD. So they usually take the FCPS ones easily, uh, rather going for MS or MD programs. In private hospital, you can go for, I mean, you can use your diplomas or MCPS degree for a few specialties like anesthesia, like chest medicine, like dermatology. They usually have these kind of qualification, and they are working well in the private sectors as well. So talking about uh, the international scope. So international scope, we usually are people with the FCPS degree. They are well recognized in the Middle East, Saudi Arabia, and they usually go there and work there as a. They can start with the junior faculty. Uh, we call them the assistant, or the and then we call them the specialist mainly now, and then they can go for a consultant post as well. But with the more number of people coming from Europe and US as well to the Middle East because of the higher income and no taxes, so they are now considering to to take uh, the foreign qualification or European qualification more than the our FCPS degrees. But still, a lot of people are going there and they are working as a specialist over there. But taking the post of a consultant over there, that can be a little tough at the moment. But still, you can go there and work as a consultant or a specialist. Similarly, if we talk about the European, generally the other European countries, they do not take our degrees. Or similarly, if you're talking about the UK as well, they have a problem that they need to, I mean, a person, even after the qualification of FCPS, he has to be registered with the GMC. And for that registration, they need different kind of exams, starting from PLAB, MRCP, or MRCS. You have to clear those exams before you can start working there. And with the FCPS degree and an exam of like MRCS in the surgery or MCPS in the medicine, they usually take you as an SR. And after that, you will have to have, you will have to get a FRCS degree or FRCP degree over there, and then you can get into the pool of consultant over there. But before that, they usually take you as a senior registrar or registrar. So now coming to the SCPS pathway. So generally it's a long pathway. It takes 4 to 5 years. When you join as a trainee. But before that, obviously, you have to prepare for the FCPS Part 1 as well, and that takes time from even 2 months to 6 month time, or that can be longer as well if you're unable to clear your exam in the first attempt. But talking particularly about the whole journey of FCPS, it's like a 4 to 5 year program. But different institutes where you are trained, they have different requirements. Like Aga Khan, in subspecialties, they take you for 6 years. Although the FCPS pathway is for 5 years, but they hire you for 6 years because they ask you to work one more year over there and clear your exam during that time. That can be beneficial for you, or that can be I mean, like a kind of headache for you as well, if you are planning to go abroad or trying to get your degree early on and move on with the degree. So but it is an institutional policy, so you can go through that. So, talking about the FCPS pathway, we will start with the part one. Then you have to have a registration with the CPSP, because FCPS is a College of Physician and Surgeon of Pakistan exam. So you have to register with them. We call them the RTMC. And after that, once you are registered, then you can start your training at different institutes. And at the mid level, like after 2 years, you have to appear in an intermediate module exam that is called the IMM exam. And then at the end of your training, that can be 4 year, that can be 5 year, depending on different specialties, you have to appear in the FCPS Part 2 exam, that is the exit exam. And once you clear that exam, you can apply for your degree. So that's how the whole pathway, I mean, in the simplest words, I can describe. So talking about SCPS again, it is, as I said, this is one of the gold standard or premium postgraduate medical qualification in Pakistan. It is well structured program. I mean, it's not like different university programs. If we talk about MS or MD program in Punjab or in some other provinces, we have a very good structured MS and MD program. But in Sindh, generally the different universities are dealing with these program, and they are not I mean, they're not well structured. But CPSP or the FCPS exam or FCPS qualification or the training program is a well structured, where the trainee completes his training under the supervision uh, of a senior consultant or a supervisor. And obviously the institution also takes care of the different requirements that are asked from the candidate to go through during these training programs. So they achieve their levels from starting from year one, then year two, three, four, and five. They have to have a qualification that is progressively increasing with the training and with the expertise over the 5 year period of time. So coming to the fee structure, generally FCPS Part 1, it used to be a 15,000 PKR exam, but now for the last 2 years, I guess they have changed the fees because a large number of people are going to attempt these exam, and and a lot of people are those who do not even, I mean, they are not well prepared before the exam, and they just simply fill the form because they think that 15,000 is not a big amount, and they just apply for the exam and CPSP. Because it has now become a computer-based exam, so they have a limited resources. So that's why they have increased the fee structure, and now it's 25,000 for FCPS Part 1. Then after the FCPS Part 1, once you clear your exam, then you get your registration with the CPSP, that is the RTMC. There is a particular fees, uh, around 5 to 10,000. That is the RTMC fees. And at the end of the your training, you have to appear in the FCPS Part 2. That has a fees of 15,000, much less than the Part 1 actually. But each time you appear in the exam, you will have to, I mean, you will have to pay these amounts. For example, if you are doing a part, you are going for Part 1, and unfortunately you didn't clear the Part 1 exam, for the next attempt you will have to pay the very same amount again. Similarly, for Part 2, if you fail that attempt, you have to pay the similar amount again. But uh, generally, if we talk about the IMM exam or the FCPS Part 2 exam, because there are two parts in those exams. One is theory part, and other is Viva part or the clinical part. So if you pay once and you appear in the exam, and you clear the theory exam with the same fees, you do not need to pay again for the clinical exam. So if you clear the exam, you can appear in the clinical exam with that same fees. But if you fail the clinical exam, then you will have to, uh, you will need to pay again for the clinical exam. So that's how it is. And generally, they allow the three attempts to be made for the clinicals. And if you still unable to pass the clinical exam, then you will have to reappear in the theory exam. This is for the IMM and part two. It's not for the part one, because part one is a different kind of exam. We will go through the details of the part one in a while. And CPSP has a well established website and a portal system. And you can go there, you can create your login over there, and then you can apply through that portal. And uh, throughout your FCPS training, you will have to use that portal for each and every step. Like if you are going for any workshop, or you are attempting the exam, or you want to get any certificate, or you want to pay for your annual fees. So all the things are through that portal. Eligibility and required documents for FCPS Part 1. Generally, the requirements for FCPS Part 1 or for any other postgraduate qualification in Pakistan, it is MBBS degree or from a well-recognized PMDC recognized institute, and then a valid PMDC or PMC registration certificate, and then 1 year house job uh, certificate after your completion of the house job. That three things are mandatory to be eligible for the FCPS Part 1 exam. So, what other requirements? Obviously, uh, to to show that you are a well qualified MBBS doctor, you will have to show your degrees and transcripts. Similarly, for house job, you will have to show your 6 month in two parts or 1 year certificate of the house job. You will have to have a Pakistani NIC, and then there may be some other documents like pictures or challan forms. So these are the different requirements for FCPS Part 1. There are different subjects that are allowed for the Part 1 exam. Okay. So generally people opt for medicine and allied or surgery and allied if you're going for a medicine related field or a surgery related field. But there are other fields as well for which you can directly apply for a FCPS Part 1. So if you know that you want to go into a particular field, and that field is listed here, you can directly appear for FCPS Part 1 in that field. Otherwise, you will have to go through the details of medicine and allied or surgery and allied and choose your particular field, and then you can appear. Then you can apply through the medicine and allied or surgery and allied. Venues are different in Pakistan. There are multiple venues. There are main regional centers, and then they have the smaller centers as well. So the centers are listed here. The CPSP main office or the head office is in Karachi, uh, and in DHA. But other centers are Lahore is a big center, Islamabad is a big center. But apart from these two centers, there are smaller centers like Abbottabad, Multan, Hyderabad, Ladkana, Quetta, Peshawar, Bahawalpur, Faisalabad, Gilgit, and they keep on increasing with time. And you can appear in FCPS Part 1 exam through any center. It's not necessary to come to a particular center and appear in the FCPS Part 1 exam. You can apply and you can choose any of these centers at your convenience. So FCPS Part 1 is a computer-based exam, and it has two parts, 100 MCQs per paper, and the duration for each paper is 2 hours. I guess it's 2 hours. It's not 3 hours. It's 2 hours actually now for each paper. So 120 minutes for 100 MCQs. It's like 1.2 minutes for each MCQ. So it used to be like 3 hours paper, but when it was in written, not computer based. But now it's computer based, so they have decreased the time to 2 hours now. So paper one, this usually deals with anatomy, physiology, biochemistry, pathology, pharmacology, microbiology, and they usually take the basic concepts or basic medical knowledge of these these subjects, and paper two deals with the scenario based or clinical uh, 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 questions. So you have to go through both the exam, and you have to clear both exam to be uh, labeled as FCPS Part 1 qualified. The SCPS Part 1 exams, there are four exams per year, and but one candidate can attempt a maximum of three exam each year. Okay, so I mean there are four exams going on for FCPS Part 1, but you can only opt for three exam if you unfortunately fail an exam. So you can go for two more exam in that particular year. And generally, there are unlimited number of attempts for FCPS Part 1. You can appear as many times you want to. Uh, I mean, obviously, it's a you would like to, and you would love to clear in the first attempt or the earliest attempt, but you can go for multiple attempts. Results are generally, again, they are announced very quickly now because of the computer-based exam. And it used to take like 1 month or 1.5 months previously, but now it's within weeks they announce the exam. And usually they announce the results on the portal, which you already, I mean, will have once you apply for the FCPS Part 1. So training registration with the CPSP. So this is the e-portal kind of thing. So you can have different links over there, and you can click on the particular link to get registered with the FCPS. Like as you can see, e-portal, fresh register in RTMC. So you can get a fresh registration with the RTMC using link one or two. Both links go to the same thing, and you can join there with your FCPS Part 1 number or the roll number, enrollment number, whatever you have over there, and you can get registered with that. Obviously, they will require uh, different documents for that. They will require your MBBS degree. They will require your house job degree. They will require your different attestation documents. Also, they may ask for the metric and intermediate degrees as well, and they can also ask for for your picture. And same, I mean, we have the same page, but you can use another link for FCPS Part 1 exam application. And once you are registered with the FCPS, I don't know if you guys can see this cursor. This is the trainee fellows supervisor e-portal. So once you get registered with with the CPSP, you will have a different link for that. It's called the e-portal or the logbook, generally we call them. So you will have a logbook over with the CPSP, and through that logbook or e-portal, you can do all the rest of the things like workshops or IMM exam or Part 2 exam, or your cases. You have to fill that logbook as well. So talking about the training program, the the problem with the FCPS training is that you have to get registration with the CPSP. I mean, you have to clear the Part 1 exam and then get registered with the CPSP. But before that, once you have cleared your FCPS Part 1 exam, you have to appear in different institutional exams. Like different institutes, they ask for, I mean, they announce their uh, exams or tests for inducting the new trainees. And they usually, there are some institutes that announce these exams annually, or some institute announce them 6 monthly. So you have to appear in that institution, in a particular institution you want to get trained. And once you clear that exam and uh, you get the job or the training post over there, then you have to get registered with the RTMC. So first step is clearing the Part 1, and then you have to choose your institute and clear that exam for that particular institute. And once you are done with that, they give you the appointment letter or the joining letter or the training letter, and then you can use that RTMC portal and get registered with the CPSP, showing them the appointment letter you already got from your institute. So this is, I mean, kind of a little tricky, because sometimes you just you are able to clear your FCPS Part 1 exam in the very first attempt, but unfortunately, you are unable to, get the training post at your desired institute or at any institute because a huge, as I said, a huge pool or large number of people are clearing these exams, and there are very limited slots for the training in the whole Pakistan. It's not about the province of Sindh or the Karachi. It's for the Pakistan because a lot of candidates have to wait for a long period of time before getting their induction in those institutes. So this is very important uh, to be well aware of those exams or those tests because sometimes they announce those tests before your FCPS Part 1 time, and they even allow you to appear in those exams, and they will hold your result, and they will ask you to show your FCPS Part 1 exam result, and then they can appoint you. So few institutes they take those exams before FCPS Part 1, and few institutes like government institute they are the last one to announce these posts. So you can clear your FCPS Part 1 and then appear in those government institutional exams. So after once you are registered with the CPSP, as I said, you will have your own logbook or e-portal and all those things, all the training. From starting from the syllabus, training syllabus, and then the training requirements. There are different requirements for training, like you have to clear those exams, obviously, but apart from that, you have to have a particular expertise in that field uh, before you can attempt those exams. So for each level, for each year, or for each 6 months, there are different required assessments or logbook things that you have to fill on your e-portal. Like if we talk about any field of medicine, you will have to fill those logbooks with different cases you see during your training. So generally it used to previously they were very lenient with the trainees, that they did not they easily the trainees used to fill their logbooks at the end of their training. After completing their 4 or 5 years, they used to just sit before the exam, and within 2 weeks time or 1 week time they used to fill all the cases, 150, 200, 300. They used to fill those cases, but now CPSP has restricted them, and they have they have made a system where you have to stay updated with your logbook. So after every 3 months, they check if you have activity on your logbook, then it's fine. Otherwise, if you do not have a proof of activity on your logbook, like you did not add any case on your logbook, they will lock your logbook. And to unlock, you will have to apply for that. You will have to pay some fee, and you will have to give some explanation as well. And if it is locked for a longer period of time, they they do not allow you to appear in the next exam. So this is very important to stay updated with your logbook nowadays, and you have to fill your cases on your logbooks. And obviously, for FCPS Part 2 or exit exam, you will have to clear your IMM exam, and you will have to show your logbook that is, well maintained. So these are generally the requirements for FCPS Part 2. Obviously, you will have to get a training letter, the completion of training letter from your institute as well. These are few notification, because I just wanted to show you that previously in medicine and allied or surgery and allied, there was a 2 year general medicine or general surgery program. And once you are done with the general medicine or general surgery, you can choose your specialty after 2 years, and then you go there and train for next 3 years. But over the period of time, people have seen that those 3 years are not good enough to train a particular candidate in that specialty. So now they are coming with the a different program where there is 1+4 formula or 1/4 formula, where you have to directly join the specialty you want to. Like if you are, as this letter can show, orthopedics or neurosurgery. So if you are interested in orthopedic and or neurosurgery, you have to get registered with neurosurgery. Okay. And then once you join the neurosurgery, then you have, I mean, you can go on rotation for 1 year to general surgery or subspecialties, and rest of the 4 year you will have to train in the neurosurgery. And same goes for orthopedics as well. But previously it was like 2 years for medicine and then 3 years for neurosurgery, or I mean, sorry, 2 years for general surgery and 3 years for neurosurgery, or 2 years general surgery and 3 years orthopedics. But now it's 1/4, only 1 year for general surgery, and it's not the whole year for general surgery because it is 6 months general surgery, and then rest of the 6 months uh, they go for three different rotations, and those rotations are different for each specialty. Like in neurosurgery, we rotate the people into anesthesia, emergency medicine, and neurology for 2 months each, and rest of the 4 years are in neurosurgery. But it's not for all the specialties. But so I mean, I just wanted to clear it out that there are few specialties where 1/4 program is running, but there are still few specialties where 2/3 program is going on. So you'll have to check on that particular field you want to. Some other things, I mean, you can apply for different leaves through CPSP during your training. Generally, they allow for these leaves if you apply if you apply timely, but you will have to do the deficit at the end of your training for these particular things. But there are some other casual leaves that can be applied, like 15 days leaves are allowed per 6 months, depending on approval from your institute. Okay, and you do not need to get, go for deficits in those cases. But these particular cases, you will have to complete your deficit at the end of your training, and only then you can appear in the exam. Similarly, there are different workshops. Generally, these workshops are needed for the IMM exam. So once you get registered with your FCPS, RTMC, and you get your training post, then you will have to during first 2 years before the IMM exam, you will have to go. To clear these basic training courses or workshops. These courses are different for each specialty. So in one particular specialty, usually they have to clear 3 or 4 different workshops, not all those workshops. So it depends on the specialty as well. But these are general the fees, I mean, fee structure you can see over here. Coming to the midterm exam or the IMM exam, again, IMM and Part 2 exams are theory and clinical exams. So in theory, you will have to appear in two exams, paper one and paper two. I mean, two papers, paper one and paper two, with a short break in between, similar to the Part 1 exam. And there will be 100 MCQs in each paper, 2 hours for each paper, and these are multiple choice questions. Generally, the criteria to pass the IMM theory exam or for FCPS Part 1 theory exam or FCPS Part 2 theory exam, generally the passing percentages are above 70%. It can be up to 75%. So they usually go through some kind of percentile system. So you will have to be, very good to clear those exams. Then coming to the clinicals, I'm in clinical exam. There are talk stations, and there are 15 stations for each candidate and 5 minutes per station. And these are all interactive station generally. They used to have a 5 to 6 static stations previously, but now all the stations are interactive. And in the IMM exam, they ask you about the very basic of your particular specialty, and also from the medicine or general surgery whichever you are dealing with. So 15 station, but generally here the passing criteria is around 60 to 65%. So you can be very easily, I mean, you can very easily clear these exam if you are, I mean, mediocre even in in your field. So now coming to FCPS Part 2, it is very similar to IMM exam, but there are some changes in the FCPS Part 2. I already told you the requirements that uh, uh, you have to show your IMM qualification, you have to show your completion of training of FCPS, and only then you can appear in the, and also obviously workshops and different things. But one thing I missed, there is research and evaluation unit running in CPSP. So for each FCPS qualification or part 2 exam, before that exam, you have to show your research skills. And for that, there are two ways. One way is to um, publish two research papers, original research papers, and you will have to apply for the topic. I mean, you once you chosen once you have chosen the paper or the topic of the paper, you have to apply from approval. I mean, from the CPSP, you have to apply for approval, and once they approve that topic, then you can go through the research process and publish your papers. And once you are done with the two papers during your training program, then they allow you to appear in FCPS Part 2. Another pathway, I mean research pathway, they use is the synopsis and dissertation pathway. In that thing, you can I mean you have to only write one paper, but that's again a long process because first you have to go through the synopsis thing, and once they approve, then you have to write a dissertation. So these two are the pathway for the research thing, and that is a mandatory thing for FCPS Part 2 exam. So coming to the FCPS Part 2, the written component or the theory component, again, there are two papers, paper 1 and paper 2, 100 MCQs in each paper, and 2 hours for each paper. Obviously, this is an exit exam, so they will test the basic thing and the higher level things in that exam. Then you appear in the clinical or the viva component, and it has two parts. One part is talks or OSCE exam, again 15 station of talks, and each candidate will have to attend all those station. And once you clear that talks paper, then only you can go through the long and short cases. Previously, it was different. After the theory exam, once you clear the theory exam, you can appear in both talks, long and short cases. But now they have restricted. First, after the theory exam, first you have to appear on in the talks exam, and if you clear that exam, only then you can appear into the long and short cases. Again, this is because uh, people are increasing in number and CPSV has limited facilities to conduct these exams. So that's why they try to just stick these exams, because long cases and short cases take a lot of time. So each long cases is generally 1 hour exam where you have to take detailed history of the patient and detailed examination. And then you have to appear in front of the examiner for like 30 minutes question and answer session. And in short cases, for each exam, each part 2 exam, generally there are 4 short cases and 1 long case. And for short cases, there are uh, 10 minutes for each case, 5 minutes for written examination, and then 5 minutes for viva. So these are very, I mean, short. I mean, they test the particular examination. Like for example, if you are going through the whole neurological examination, it will be done in the long case. But if they ask you just to examine the upper six cranial nerve or the visual thing, or they ask you to test the motor system, so that will be covered in the short cases. So again, all these toll stations, long cases, short cases, they are observed by the examiners, I mean the senior examiners, and you will have to go through the question answer session with the senior examiners. So this is all about the clinical exam of FCPS Part 2. Obviously, I mean, once you are done with your the whole training, you are good enough to appear in the exam, and you have gone through all these challenges. I mean, you can name any challenge like the family thing or the work-life balance thing or the burnout thing, but obviously you are good enough to go and face these challenges, and only then you can clear your degrees. Just because of the short period of time, I'm just going through a few slides. I guess, I mean, this part two thing is very much detailed here, and this is not the particular, I mean, uh, but what I can say, I mean, we should not go through details of the part two, because this is the last exam you will have to face at the end of your training. Particularly, we will go through the part one exam in detail. So, coming to part one preparation, so I would try to cover all the aspects of part one. So as I already said, you will have to have a degree of MBBS. Then you will have to have a 1 year house job training completion, and only then you can appear in the FCPS Part One exam. And FCPS Part One exam is a computer-based exam. Paper one and paper two, each paper has 100 MCQs, and for 2 hours each paper has 2 hours to go through, and then as part one, the paper one, it is basic sciences, and paper two is specialty based questions. So in paper one, you go through the anatomy, physiology, pharmacology, biochemistry, pathology, microbiology, research, biostatics. The main subjects here are anatomy, physiology, and pathology. Rest of the uh, rest of the components or rest of the subjects are minor as compared to these three. So anatomy, physiology, and pathology are the topmost. I mean, they have the maximum number of questions coming in these exams. So coming to part two, paper two, medicine and allied, very clinical, basic questions about the medicine or the surgery or any other field you are appearing in. So these are specially based exam. Again, they will not only talk about the anatomy or physiology or pharmacology or pathology, but they will give you the clinical touch of those particular subjects. So in paper two, you will have to deal with these specialty based exams. Special based questions. Again, the very same thing. Part one validity is 3 years from the passing. So you will have to get registered with the RTMC and get your training post within that 3 year period. Okay, so this is very important, because again, I have seen people who waited for more than 1.5 year or 2 year to get registered uh, with the RTMC or get any training post. So this is very, again, I mean, very important that once you have decided that you are going through the FCPS Part One exam, you will have to um, check with the different institutes and their exams as well. So study books, generally they are divided into three parts. One is the textbooks for each of those subjects like anatomy, pathology, physiology, or any other like biochemistry or microbiology. Then there are MCQs books which you need to go through and test your preparation. And then at the last, there are few past paper groups as well, pools as well, or books are also there that you need to go through I mean, stay aware of the kind of uh, questions you will have to face in that exam. So these are three kind of books or three kind of materials you will have to uh, go through. Obviously, textbooks, they are here to help you with the to build deep conceptual and understanding, and they are essential obviously for reasoning in part two particularly, but obviously part one as well. The paper one, they are also uh, they're very helpful in those. And once you are done with those textbooks, I will go through the name of those textbooks in a while. But once you are done with the textbook, You can go through those MCQs books or the past papers, and there are some other guidance books which you need to carry throughout your the preparation. Like for example, if you talk about the subject books, if you're talking about the anatomy, Snell's clinical anatomy or the review book, sometimes some people are good enough to recall those anatomies who you have read like 3 4 years back, and the review books are good enough in for some people, but it's not necessary that you go for the larger kind of books. So you can go through the review books of anatomy, physiology, and pathology, and they are good enough because you are going through the past paper, you are going through the MCQs papers or the revision books. So those are much helpful in those cases. But if you have a particular topic or or subject, like for example, some people have difficulty in neurology section or neuroanatomy section, so they can go through the Kaplan, and they can take the help from that book as well. But for rest of the things like general anatomy, the Snell clinical anatomy, or the even it's a review book, that is good enough to start with. And obviously, you will have to need an atlas or pictures to to memorize those anatomy. Going through physiology, BRS for physiology and pathology is good enough for part one exam. But if you think that some concepts are not clear, or you need more help with the different clarification, then you can go for Kaplan for physiology, and similarly Pathoma for pathology. But these are larger books. These are, longer books. So you will have to be very careful. If you start with those books, it will take a long period of time. And then you will have to go through the review books as well. FCP, First Aid for USMLE Step 1. It's a very good book for FCPS Part 1 exam. A lot of people, they do not go through any other book. They just go through the FCPS, First Aid USMLE Step 1 book, and then they go through the MCQs or different pools, and they clear their exam. But it all depends on your own choice as well, and your own understanding of your capabilities as well. This is not for everyone. So you'll have to start early. Starting should be within the house job period of time. So if you are planning to go for FCPS training, then you should start earliest at the house job level. Particularly, you can enjoy and get very well trained in the first 6 months of your house job. But after the first 6 months, it is ideal that you should look into the exam structure or the exam things, and go through different books as well, or at least get uh, um, get attached to, or get connected with the people who have already appeared in the exam, or at least are appearing in the exam, so that you can know what are the different uh, books or different pools, or what are different difficulties they are facing, and how much time you will need uh, to take before attempting the exam. So this is very important that you start at your earliest. So there are other review books as well apart from first aid, because first aid, it is a combination of all these subjects. So generally they have, the first aid book is a systemic book. So they have, uh, they have it's written in a systemic way, like cardiology, like any other thing, neurology and chest. So 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 this is written in a systemic way, and over there you can go and you can see the anatomy of that system. You can go through the physiology of that system. You can go through the pathology of that system as well. And the rest of the subjects like microbiology, like biochemistry, they are also covered in this first aid book. So you do not need to go through a particular in a particular book for those minor subjects. So you can only take the help from first aid book or your any other review book or past papers as well. you can see different names as well. There are different books. They keep on changing with time and क्या कहते हैं उसको uh, with the period of time people simply जो है ना वो जो जिससे पास हो जाता है उसको लगता है कि बस वही बुक सबसे अच्छी है. So it's not necessary that you take anyone's advice and just go through that book. Idea is to get those books, see whichever book is is more understandingly easy for you or convenient for you, you can go through that book. All the books are same in that matter, but first aid book is very important. Other books you can go through any book or any pool, but depending on your basic subject preparation and your grip on the first aid book. So generally, when I tell someone to tell someone about the preparation of the FCPS Part One, I just tell them that you will have to start with the basic books or the subject books. Physiology is very easy to start with because anatomy sometimes is very boring to start with, and it's a long subject, and it has you'll have to memorize each and everything from attachment from the the nerve supply and the blood supply, and so there are long list of things to remember in anatomy. But physiology is a very easy subject to start with, so just start with the BRS physiology and see how you to how you feel about it now, and then you can go through the pathology, and at the last you can go through anatomy, or after physiology you can go through anatomy and then pathology. But keeping the first aid with you all that time, you will have to, whatever subject, whatever the system you are reading, you should go to the first aid and read it out, and also mark your whatever the notes, whatever the things um, you are easily to forget, you should mark them on your first aid thing. So first aid should be your guide throughout that exam. Again, this all depends on your personal choice and personal scenario. Particularly if you are starting early and you are working as an house officer in a hospital, and you have calls and you have other presentations and different kind of stuff to deal with. So you can start early, and you can just start with the 1 or 2 hours initially, just to have a idea, or just to have a feel of studying at the start. So 2 to 3 hours, 2 to 4 hours, that can be good enough during your house job period. But once you are done with your house job period, then you will have to have a particular schedule for these exams. Ideally, 3 months is a good enough time to appear in that exam, depending on your early preparation during your house job period. Some people do appear within 2 months' time or 1.5 months' time. That is a little risky to start with, but depending on your preparation during your house job, some people have very easy departments at the end of their house job, and they can utilize their time to prepare for part one. But some people have different difficulty different difficult subjects or departments, like emergency, like neurosurgery. We have a very hard schedule or tough schedule, so they could you cannot take out your 5-6 hours per day. So it's only 2 to 3 hours maximum you can use in that period of time. But after the house job, you can go through. You can use your 8 to 10 hours at least for this exam. If you want that, you should clear it in your first attempt. And talking about the MCQs and the pools, you should once you start like physiology or anatomy, you should look into some papers as well, some past papers or MCQs paper as well, so that just to have an idea what kind of question they are asking in those exams, so that you can have an idea while studying those particular books. अदरवाइज क्या होता है कि आप पूरे सब्जेक्ट आपने पढ़ लिया, यू हैव रेड इट आउट, एंड वंस यू गो to the past paper, you are unable to attempt any question because those questions are in a different way or in a different clinical scenarios, and you are not well prepared for that. So this is very important that you should keep your schedule like that, where at each weekend or within the day period of time, even some people do that, they study from for like 5 6 hours, and then they go for the MCQs 2 3 hours, so that they have the idea of different MCQs as well, because some MCQs are uh, repeated over different exam. So you have to be well prepared for those as well. Again, very the same thing we can talk about over here. But again, just as I said, 3 months period is a good enough time, but you can go up to 6 months, or you can or 4 month time as well. But minimum ideally 2.5 or 3 months period is should be there to before you appear in the exam. Okay, as I told you earlier, there are 4 exams per year for part one, but maximum number of attempts for each candidate per year is three. And the rest of the details are already discussed, paper one and paper two. And passing is, as I said, is different for each attempt. They take the percentile system, and it's not necessary that you pass at 71% or 72%. It can be different. You can fail at 73%, and you can pass at 70%. But generally, the CPSP, they do not tell you the percentage if you clear the exam. They only tell you the percentage if you fail the exam. So it can be different. So some people, those people who are unable to clear their exam after multiple attempts, they see their progress through the percentages, but it can be very different for each attempt. So that's what I am trying to tell you, that um, it's not necessary that if the last attempt you got 65% and now you are getting 73%, it's not necessary that you have gained more knowledge. It can be an easy attempt, this time. So every time you will have to have a good preparation before you attempt the exam. So again, you will have to be very consistent for the study thing and for the MCQs preparation as well. You will have to go through different mocks exam or different MCQs. There are some mocks exam going on as well nowadays. CPSP also conducts different mocks or preparatory sessions for these FCPS Part 1 exam. So you can go through them as well. But my idea is that you should utilize that time to gain more knowledge and prepare for your exam rather going and joining those sessions. But if there is a session that is limited to like 3 days or 1 week time, or very uh, for a small period of time over these 3 months or 6 months time, then you can join those programs. But if some program is uh, taking longer period of time, like 3 months or 6 months, then it's not very helpful for you guys, because you will have very limited time for your own preparation. uh, all the books, all the textbooks, those should be at least read out twice. This is what the people who clear in their first attempt, they tell everyone that at least you should start with the first reading, that then you can go through the first aid and different MCQs pools, and then you can get back to your books and read out whatever you have missed, or whatever is you are facing difficulty with. And then after the second read, you can only rely on the first aid and then the MCQ pools. Uh, common mistakes are again those that like timing or the duration of your preparation is the very important thing to start with. That you should give yourself good enough time to prepare for that exam, because you can have some problem during that period of time, and you are away from study for like 10 days or 1 week, and it can daunt your preparation. So it's very important that you schedule your exam at least 3 months for the 3 months, and you make a schedule for each day and you cover it out somehow. Relying only on the MCQs is not a good way to clear this exam. There are people who can be smart and who have good knowledge, or maybe they have prepared well during their house job period of time, and they just simply go through different MCQs and appear within 1 month of the house job. They appear in the exam and they clear out. But it's not uh, good uh, thing to follow those people, because it can be different. People can be disguised with these things. So it's important that you get well prepared, and obviously you attempt different MCQs to see your knowledge. Again, inconsistency is not very much helpful in these cases, because if you are away from study, you just simply forget, at least for the anatomy thing. Anatomy is very important, because anatomy, particularly if you're talking about the surgery thing, anatomy is very important, and you easily forget those things about the anatomy. So consistently, repeatedly, you will have to have those things, recalled again and again. Rest, obviously, attempting an exam is an art. You have gone through different exams throughout your MBBS program, so you know how to manage your exam in that particular on that particular day. So it's important to attempt all those questions at the very start who are easy, or you are sure about, and only you can keep like 10 to 15% of the question at the end, and then you can go through them again. But if you are leaving a large number of questions, like 30 questions or 35 questions, you will not get good enough time at the end. You will have to miss out some questions. So it's very important that you manage your time during your exam. The last thing I would like to discuss, I don't know if you guys are interested or not, but choosing specialty is very important. If you are talking about these exam or any other exam, any other postgraduate degree, you should be very careful while you are choosing your specialty. So there are different ways uh, to to see your interest, or choose your specialty. It can be your interest, it can be opportunity you are looking into, like if you are seeing that orthopedic or neurosurgeon or dermatologist, they are less in number in the field, or in your particular area where you are residing, or you want to work in work in future. That can be also taken in consideration. Financial aspect of your qualification and post qualification work thing. uh, is it an easy program, and you want to uh, manage your work life balance very well, then you will have to choose a different field depending on your interest. So again, the top thing while choosing the field is that your interest. It is always important to have a interest your MBBS period period, or during your house job period, that you should um, narrow down your interest in different fields. Like if you think, yeah, I'm more fit towards the medical field or a medicine field, or more fit towards the surgical field. Like people have different interests. People know their capabilities, their positives, their strong points. They 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 know that I'm more interested in a medical field, where I just want to go through clinical things like history and examination, and I'm good at finding out the particular pathology of that patient and then treating them. Or another candidate can say that I am good with my hands, and I'm good at surgical skills, and I'm much more interested in those things. So that's the very important, the very first thing you should be considering, depending on your interest. Then in those like medicine or surgery, you can choose for a particular field. There are a lot of fields now, and every field has a different, has a FCPS degree program. So again, depending on your interest, you can choose your specialty with. Work life balance is again very important. It's not an easy thing for everyone that uh, if someone who wants to have a 8 to 4 job or 9 to 5 job, and he wants that rest of the time should be with my family or for my own thing. So they will have to they should choose some easier kind of fields, or the fields that have those kind of jobs. Like for example, if you if you look into emergency medicine, generally emergency medicine, people are doing shifts duty, so they have a 8 hour shift. So if you want to have a career in that thing, you can have a very good work life balance. But again, depending on if you have a particular shift, if you have a rotational shift, then again it can be very difficult for thing I mean for some people. So, and in each and every field there can be difficulties, so you will have to uh, start early. While you should go to that department, you should see people, you should go and meet people over there and see what they are getting actually while working in that field, or what they have gained over the period of time after their qualification. So this is again important that you talk to your interest specialty people. It can be a R1 trainee, it can be an R5 trainee, it can be a junior consultant, it can be a senior consultant, so that you know the different difficulties and different benefits at each level, and then you can decide about your field. Again, as I said, the institution and the training programs or the training slots actually, they are getting sh- shrinked as compared to the number of people who are clearing FCP as part of an exam. So you will have to choose a field where you think that you can rather easily get a training slot. So you should choose that kind of field. Similarly, if you want to get into a particular institute and you know that there are only 1 or 2 seats in that program in that institute, and you think that there are a lot of people over there, or some people are already in touch with them, and you know that you will not be able to get that seat over there, so choose wisely and choose accordingly. There are few fields where the training seats are always available, and then there are fields where there are, the training seats are very much occupied already. So you will have to choose accordingly. Then obviously, you will have to decide whether you want to work in Pakistan or go abroad eh, in future. So you can choose accordingly as well. So if you are looking for a career in Pakistan, you can simply, slow down your thing. You can work with the things, and you can just stay in the loop where you can have a faculty posting. But if you want to go abroad and work internationally, you should during your period of training, or even before that, you should start early with the research thing or different workshop thing, because in your career this is very important. In each and every interview they will ask about your research interest, your research papers, and different workshops or different activities you have done your uh, over the period of time. So this is again very important. So choosing a specialty is very important at the start of your training, and obviously it will improve your CV, it will build your career as well. So you will have to look into each and every aspect of that field. So these are the last thing. I mean, better you have a schedule rather going using all the time and always stressed out with the exam. It's better that you decide that I am going to study for like 6 hours, 8 hours, 10 hours, and then I will have rest of the things as well, like any physical activity, any social connection with the family or with the friends, or any other thing you want to use mobile or watch movies. And you should always have a good sleep, because the next day study or the next day outcome all depends on your sleep as well. But if you are short of sleep, you can, you can, uh, you can be brave kind of thing. कि यार आप कह रहे हैं कि यार मैं तो बस कम सोकर भी मुझे जो है ना सब कुछ याद हो जाता है, बट अगेन इट विल नॉट हेल्प यू इन द लॉन्ग रन. ठीक है. And a similar thing goes for the exam as well. That if you have the exam on the next day, you should have a very good sleep before that. So begin early, prepare. Well, you should be well prepared. At least you should have a confidence that I'm well prepared. ये सवाल जो है वो खुद से जरूर पूछना पड़ेगा आपको, या पूछना चाहिए आपको एटलीस्ट, दैट am I well prepared for this exam or not? If you think that you are not well prepared and you have good enough time, just go through your deficiencies and prepare them, or leave that attempt and appear for in the next attempt. It's not necessary कि आपने अगली attempt ही देनी है, because people think यार हमारे साथ के जो लोग हैं वो हमसे आगे निकल जाएंगे. ऐसा कुछ भी नहीं होता. ठीक है. ये अगर अब कुछ चीजें जो लास्ट में अगर मैं आपको बताना चाहूँ, जस्ट वांट टू से इन उर्दू, बिकॉज कुछ चीजों की अंडरस्टैंडिंग आपको उर्दू में बेहतर आएगी. सो द थिंग इज के कोई भी आपसे आगे नहीं निकल सकता. ठीक है. इफ यू आर गुड इन योर फील्ड, इफ यू आर गुड इन योर, आई मीन यू हैव द टैलेंट, तो कोई भी आपसे कहीं पर भी आगे नहीं निकल सकता. हाँ, ये जरूरी है कि यू शुड क्लियर योर एग्जाम टाइमली, बट इट्स नॉट नेसेसरी कि आप किसी को देख करके यार वो एग्जाम में जल्दी अपेयर हो रहा है तो आई शुड, बस मुझे भी अपेयर होना ही होना है. फेल होने से बेहतर है कि आप वो अटेम्प्ट ना दें. डू नॉट लूज योर कॉन्फिडेंस जस्ट बिकॉज ऑफ योर, क्या कहते हैं उसको, कहते हैं कुछ और, आई डोंट वांट टू से इट, बट आप उस जल्दी में ना पढ़ें. ठीक है. जस्ट गेट योर प्रिपरेशन एंड देन यू अपेयर इन दोज एग्जाम. किसी और को देखकर जल्दी एग्जाम में ना, हो सकता है उनको ट्रेनिंग स्लॉट ही ना मिले एंड आपको देर से एग्जाम पास करने के बावजूद यू गेट अ ट्रेनिंग पोस्ट. सो इट्स ऑल देयर. ठीक है. हमारे साथ जो हमसे बहुत पहले जो लोग कर जाते हैं FCPS पार्ट 1, वो भी हमसे बाद में FCPS पार्ट 2 दे रहे होते हैं. ठीक है. उनका एग्जाम पार्ट नहीं हो रहा होता, मतलब क्लियर नहीं हो रहा होता. सो दिस इज अ लॉन्ग जर्नी. सिर्फ पार्ट 1 एग्जाम नहीं है कि आपने जल्दी स्टार्ट कर लिया तो आपका पार्ट 2 जल्दी निकल जाएगा. ऐसा हरगिज नहीं है. ठीक है. सो इट्स इम्पॉर्टेंट कि आप जो है अपने आप के लिए मतलब think about yourself and your talent, your confidence. These are the things that are very important. Thank you so much. That's all from my side.
Okay, someone is asking, as transcripts are required, does GPA matter for getting desired field?
So I didn't get you. Transcript?
Are required, does GPA matter for getting desired field?
Yes, obviously, because nowadays institution, they do not only take the written test, they also take the interviews as well. So if you have different papers or different experiences to show, then obviously they will be very helpful.
What about dermatology? Do we have to do medicine first?
Yes, for the dermatology, you will have to go through the medicine first for 2 years, and then you can go to the dermatology for 3 years.
Also, someone is asking, does this apply to cardiac surgery?
Cardiac surgery?
G.
Yeah, I guess cardiac surgery is still with the 2+3 program, so you will have to go to the medicine first and then cardiology.
Do electives and research matter for our CV before appearing for part 1 and institutional exam?
It's not important for CPSP, but it's important for the institution you want to work with.
Uh, it's saying if a program says that eligibility to appear in it requires 2 years of internal medicine training, it means practicing internal medicine in residency after passing FCPS part 1.
No, it's not that. No, yeah, obviously, after part 1, you will go to the internal medicine or the medicine department and get trained for 2 years, and then you go to the specialty you are applying for. Okay, so it's like that.
Can we use guidance physiology and KLM anatomy instead?
You can use any book. I didn't mean to say कि जो मैंने books बताई हैं वही हैं. You can go to any book, but you can see the Guyton is a large book. I mean, hardly anyone completes in their MBBS program. So it's better to choose a book that can be, I mean, helpful as well, but it's short as well. It's not necessary to go through the larger book or the longer books. I never said that even for the anatomy, you can go for the review book. हालांकि anatomy is a difficult thing, but still people कुछ लोगों को अच्छी knowledge होती है, they can use the review book, तो काम हो जाता है उनका बहुत आसानी से. तो उसके लिए again important ये है कि you try to attempt different questions as well. जो MCQs की जो pool की हम बात कर रहे हैं, so आप अर्ली ऑन भी आप साथ साथ जो है दिन में 1 घंटे 2 घंटे, अगर आप 8 घंटे पढ़ रहे हैं तो 2 से 3 घंटे आप MCQs भी करें, सो दैट यू कैन नो कि आपकी जो प्रिपरेशन है वो उस लेवल की है भी सही या नहीं.
Can we appear for more than one specialty in FCPS Part 1?
Yes, you can go. I mean, for one attempt, you can only choose one specialty. But uh, if you want to change the specialty in the next attempt, you can.
I think they're asking that after completing house job, they can go for training, and then during training, can they apply for FCPS Part 1?
No, what kind of training? That depends now. If you have started with a diploma program, like for example, or you have started with the MCPS program or MSMD program, you can anytime you can apply for FCPS Part 1. It's not necessary कि आप किसी और training program में हैं तो आप FCPS नहीं कर सकते. You can. There are a lot of examples. People who did MCPS first and after that they appeared in FCPS 1 and उन्होंने पूरी training की FCPS की. And similar for diplomas and MSMD as well.
So, like you said, the induction of new training is difficult portion. What difficulties one can face and which things make it easy, especially in JPMC neurosurgery?
I have, I mean, already talked about this thing. Difficulties हैं because there are limited slots and there are different institutional problems as well. Like talking about AQ or JPMC or DAO. So JPMC and DAO has a induction exam, or AQ का भी induction exam है, but they are far different because in the AQ they test a lot of things before uh, inducting you in the training program. They take good interviews and they talk about or they ask about the research things and your interest and your different experiences during your house job or the MBBS period of time. But talking about JPMC or the civil, their interviews are just I mean कोई खास उनके interviews नहीं होते. They all depends on their theory exam or the test.
Can
So
you
बाकी
guide about dermatology field? Is it a good option? And what's the work-life balance and income and training time?
Again, these medicine fields are, I mean, kind of a little easy in the sense कि उनका जो वर्क लाइफ बैलेंस है दे कैन मैनेज वेरी वेल. बट अगेन डिपेंड करता है कि आपके अपने इंटरेस्ट के ऊपर. इफ यू वांट अ जॉब, पर्टिकुलर जॉब जिसके अंदर एक फिक्स टाइम हो, like 8 to 4, 9 to 4 or 8 to 2, you can simply go to that, I mean join that job. और बाकी टाइम आपका अपना है. इफ यू वांट टू डू अ क्लिनिक एट द इन द इवनिंग यू कैन डू. इफ यू डू नॉट वांट टू डू द क्लिनिक इट्स नॉट नेसेसरी. ठीक है, बट ऑब्वियसली जो फाइनेंशियल एस्पेक्ट है इस चीज़ का वो ऑब्वियसली वो डिफरेंट होगा. इफ़ यू आर वर्किंग फॉर वन जॉब एंड नॉट डूइंग क्लिनिक्स, और इफ़ यू आर वर्किंग फॉर जॉब एज वेल एज यू आर डूइंग द क्लिनिक्स, so it can be different. So all depends on your own thing, your own scenario of your family, of your interest, of your busy schedule. I mean जो भी आप करना चाहते हैं, it's all up to you. बट सब कुछ अवेलेबल है. अगर आप चाहें तो आप एक पर्टिकुलर जॉब भी ले सकते हैं कि आपने किसी इंस्टीट्यूशन के अंदर जॉब ले ली, असिस्टेंट प्रोफेसर की रजिस्ट्रार की, और आप बस वही कर रहे हैं. आप कोई इवनिंग ड्यूटीज नहीं कर रहे, कहीं पे कोई क्लिनिक्स नहीं कर रहे. सो यू कैन वर्क विद दैट. Yeah, is it worth joining any societies at our
At a
university?
university for our CV.
It can, I mean, work for you, but it all depends ke what kind of societies. If you are if you're talking about I mean different societies who are more into NGO work, obviously they can help you, but they cannot take you. I mean they cannot हेल्प यू इन गेटिंग अ जॉब पर्टिकुलरली, ठीक है, वो आपकी एक जो है क्या कहते हैं इसको, पर्सनैलिटी को के लिए तो या उसकी ग्रूमिंग के लिए तो हेल्प कर सकते हैं, बट ऑब्वियसली एकेडमिक पॉइंट ऑफ व्यू से उसकी कोई वैल्यू नहीं होगी. बट इफ यू आर joining a society which is dealing with the medical education, for example, or medical training, so that can be obviously very helpful, and you can use your uh, coordinators or moderators thing or the CVs. वो मतलब आप सीवी में अपना यूज कर सकते हैं. यू कैन यूज दैट कि मैंने दैट सेशन आई मॉडरेटेड और आई जो है वो मैंने उसको कोलाबरेट किया था. सो यू कैन यूज दोज थिंग एंड दैट कैन बी वेरी हेल्पफुल.
Can you tell the range of GPAs required for ENT, neurosurgery, and derma?
No, there is no GPA. There is no GPA. As I said, it's only MBBS का सिर्फ डिग्री चाहिए. कहीं पे मेंशन नहीं है कि MBBS की GPA क्या चाहिए. ठीक है. इट्स द रिक्वायरमेंट इज MBBS डिग्री. ठीक है. उसमें कोई रिजल्ट का कोई लेना देना नहीं है उसके अंदर. ठीक है. एंड सेकंड थिंग इज हाउस जॉब कंप्लीशन. दैट्स द टू थिंग्स दैट आर इम्पोर्टेंट. ऑब्वियसली जो थर्ड है वो आपकी PMDC रजिस्ट्रेशन है. उसके अलावा कोई जीपीए का कोई चक्कर नहीं है. आई गेस पहले भी एक सवाल ऐसे ही था जो कि हम उसको किसी और तरीके से, it was about GPA. So GPA is not important in getting a training program or going through the FCPS Part 1 exam.
After house job, is it possible first we secure MO government job, then appear in FCPS Part
No,
1?
no, no. No, it's not necessary. It's not necessary. You can apply for FCPS Part 1 or get training at any point. ठीक है. कोई लेना देना उसके साथ में, जॉब के साथ में या MO की जॉब के साथ नहीं है उसका.
Okay, thank you so much, Dr. Farah, for your time. We are done with the questions. It was a very insightful session, and I hope everyone is cleared. Allah Hafiz.